So welcome everyone, and thank you for joining us last minute. Obviously, under the current situation, we want to do everything we can here at NFORS to help you all out with your data and your COVID-19 in particular tracking. So for those that don't recognize my voice, my name is Joe Chop. I'm the software engineer lead on the NFORS Analytic module. I usually help out with most of the onboarding. So I've probably met most of you, at least virtually, if not in person, at one of our trainings as well. So again, welcome, and thank you for joining us last minute. Before we dive into some of our COVID-19, as just a quick state of the NFORS update, we do want to welcome some of our new members. So Rincon Valley from Arizona came on board along with Northwest and Golden Ranch, the nearby neighbors. So they've recently onboarded with us here at NFORS. The County of LA, so LA County has joined us as well. Hall County, Georgia, Broward County in Florida, Palm Beach County from Florida as well, Simsbury volunteer, so our first volunteer from Connecticut, Madison Fire from Wisconsin, our first from Wisconsin, as well as Upper Providence Township in Pennsylvania. I think our first from Pennsylvania as well. We've been growing steadily, so we're about 7.5 million incidents now across all departments. We hit the halfway mark with representation across all states. Our accreditation departments have stayed about the same. We do want to congratulate Delray Beach, who recently was accredited last month. And we maintain a pretty healthy mix of rural, urban, and metro departments, you know, everything from LA County to volunteer departments and everything in between. And we were recently awarded a FEMA assistance grant late last year that helps fund a lot of our efforts here. In terms of training and support, for those that aren't aware, we do have a virtual training available to all departments. For anyone interested, they can contact Karan Gilmore directly at karan@ipsdi.org to schedule a training and understand the offerings. We did hold a training earlier last month, pretty much I think the week before this outbreak really took off. So we were down in Orlando right before the CPSE conference. And we held a 2-day training. So thank you for all the attendees that were able to attend that. Finally, once this outbreak is kind of settled, we are continuing to offer site and regional based training. We tentatively will be doing one in Columbus in the summer, Columbus, Ohio. But we also would be able to support any other site and regional trainings, assuming that the situation calms down by the summer. So why, that's all I really had for NFORS. Obviously, we're here for COVID-19 updates. So I wanted to highlight some of the new changes that we have both in the Exposure app as well as the analytic modules, and really just present to you a set of tools that you can start using. Obviously, we really pumped these features out as quickly as we possible, given what has occurred in the last 2 weeks. We're certainly up for tweaking them and really want to use this time to understand the data needs that you all have. And if you have any questions, concerns, ideas pop to your mind, please either speak up during this meeting or email me after to get something set up so we can really understand what you all need for NFORS to monitor the situation in your departments. So first off, we did recently finish another staffing integration. So for those departments that are on CrewSense, we do now have an interface with CrewSense, so we're able to pull in staffing information. This is in addition to those that are already on Telestaff or SDI, easy staffing software. And what this allows you all to do is, as a firefighter using the exposure module, the incidents and the possible exposures automatically populate based on your staffing assignments in the CrewSense or Telestaff software. This makes it huge, especially for those larger departments that it's really not feasible to browse every incident and assign yourself to multiple apparatuses, for example. This makes it all automatic in the exposure app. It makes it far easier to track your exposures, and especially given the current situation, we couldn't encourage this more. So again, if you're on Telestaff or CrewSense, please reach out to us so we can get that activated, or those on our Easy Staff as well. Please reach out to us if you are on either of those software so we can get it activated and tied to your department. In the mobile app, we do want to encourage all your users, so whether they're on the Android or iPhone app, to update as soon as possible. We rolled out a new update to particularly track COVID-19 type calls. So here on the video, I'll play this. Let's see if it works. So this is an example of the exposure app. This is a user that is entering a COVID-19 exposure. So they're going to go in and they're going to choose EMS. They'll select a set of turnout gear if they have one, what activity was performed, and then under the type of exposure, you want to select biological. And then you'll see COVID-19 as an option there under detail. Then the firefighter will be asked some questions about PPE equipment. So whether they wore gloves, whether they wore masks, eye protection, fluid resistant clothing, and that's all. So it's a really simple feature, but it's really important that you encourage your crews to not only update their app, but obviously log every COVID-19 related exposure. This is important for two primary reasons. We do have relationships with the CDC. We are able to share anonymized data to really understand the number of exposures that our crews are facing currently. And secondly, the shortage of PPE equipment. By asking those PPE equipment questions, we can really understand, if your department needs additional PPE equipment. Why did they not wear it if they, knew there was a COVID-19 call? So we understand that there's a shortage of PPE equipment around the nation, around the globe, really. And those two questions will help at least identify the needs of each individual department, as well as really measuring the impact of COVID-19 with our first responders.
Joe?
Yes.
This is Barry
Hey, Barry.
Nietzsche from Nurse Hellfire. How are you?
Yep. Good. How are you
Question
doing?
for you. Good. We've been filling out a lot of COVID shit. I spoke with Lori a day or day and a half ago about the exposure reports, and we found there were some additional things that were needed that she told me were already that we identified, that she said were already in the pipeline, and thought that there was going to be an update like a day or so ago. In addition to the original one that was a couple days prior to that. Anything else on that, one way or another?
Tyler or Jose, do you know the status of those?
Yeah, this is Tyler Garner. Barry, do you know specifically what the features were? We do have another pretty large one coming out regarding notifications within the next couple of days. But what other features were you requesting for Lori? I don't think I've heard of other requirements.
I'm trying to remember at the moment. We were on the phone call on it, and it was just kind of quick, like what we found already. And we hadn't really notified our troops that there'd been a change. And it was sort of like, it's coming tomorrow. And it was like, I won't notify them until tomorrow when the change is already, on the App Store kind of routine. And at the moment, I can't remember exactly without going back through and sort of looking at the screenshots on my screenshots to figure out. There were a few things that were missing, though, that she thought had already been done, that you guys had already done. It just hadn't gotten pushed out yet.
Okay, I'll follow up with Lori after this call and see what it is.
All right, and if you would need to follow up with me as well, that'd be fine too.
Yeah, hi guys, this is Jose. I'm working on those features. It's basically a new mask type and just a toggle to determine whether or not you want to share your contagious data. There's those two features, and those should be getting ready to publish either today or tomorrow.
All right, that was, I think, one of the big ones that actually Lori wanted from us was to publish to CDC.
Yes, exactly. So that should be on published to Android today or tomorrow, and iPhone is a little slower, but I'm sure I'll let Lori know, and I'm sure she'll let you know as soon as that is live for you.
Okay. Thank you.
All right, thanks, Barry. And just a couple of notes. I know we are onboarding several departments, and I see a lot of names on here that are not officially on NFORS yet. I would definitely encourage you to start using the application if you can, especially given the current situation, to start tracking COVID-19 calls. We are accelerating all of our onboarding and exposure requests, just given the current situation. So I apologize for any outstanding requests that might be sitting in our queue, but we are focusing on onboarding and getting our departments that are in the queue up and running as quickly as possible, as well as any sort of exposure or staffing integration request. We are accelerating all of those requests that are coming in. Again, this is available to all departments. If you don't have an IAC code, you can contact Melissa at IPSDI or Jose, and he can get you the IAC code for your department. So with that, I will start showing off some new features in NFORS Analytics, and these are literally hot off the press. We rolled these out yesterday.
Gave a special word to at the closing ceremony. I'm on mute.
Caller 17. All right.
And
So everyone can see.
that screen looks familiar.
So this is Barry. I hope you don't mind. I'll be just showing some demo.
No, that's absolutely fine. But I'm looking at it in stereo on dual screens.
Right. So for those that don't know, so New Rochelle has been a customer on NFORS for quite a while. I think they were probably one of the hardest hit or earliest hit communities in the U.S. for COVID-19. And Barry, please feel free, after I show this demo, please feel free to share, your firsthand experiences of, anything you all did to help mitigate the situation, best practices that you want to share with the chiefs on the line. Please feel free to share, whether it's data related or not. This is kind of meant for you all to really
One thing I would like to say, it was just a starting point is we were very pleasantly surprised when this popped up, and it was like pretty cool, and started looking at it and going, yep, these are right where we're seeing, the calls are popping up and all. This was very impressive to see this when it showed up about a week ago or so.
All right. So for all those that are familiar with NFORS, I apologize for those new customers that quite aren't up to date with how to use the system. But for you all to start using it, this is our suggestion. So come to the Workspaces tab. You can create a new one. You can fill out some information. So this is just for COVID-19. You'll see under this list of dashboards, if you remember from any sort of training or onboarding, these are the pre-built dashboards that come with every install. You'll see a new one here called COVID-19 dashboard, and we've added this yesterday. You could have created your own COVID-19 in many of our departments, including Columbus, New Rochelle. We had created ones earlier by hand, but this one is one that we have now pre-created for you all. So you can start using this without really any use at all or any modifications at all. I'll go ahead and remove some of these other ones just to keep it clean. So you just click the X. So you'll see COVID-19. Here we can select our users that want to have access. So I'll give Barry, I'll make him an owner. I'll give some of these other folks some read access. But again, this is all specific to your department. So you can either create it for yourself or you can create it for a subset of users, and we'll click create. All right. So you'll see now the COVID-19 demo workspace has now been added. By clicking it, I can enter it. So see on the list of dashboards, because I didn't add any other ones, we'll just have this empty one. So COVID-19 dashboard. So the first thing you'll notice is, I'll scroll down, you know, 1,000 instances can't be right. And this is really the key for any of these dashboards, whether you use one of their starter ones or you create your own. The problem that we're facing, at least in NFORS Analytics and probably every CAD or RMS center right now, is identifying COVID-19 related calls. Most departments obviously didn't have a COVID-19 dispatch type or any sort of contagious disease as a particular dispatch type. But we know departments have been adapting in the past or in the past couple of weeks. Different ways of identifying COVID-19 calls could be COVID-19 in the comments. The city of Columbus created a specific type for COVID-19 called Contagious Emergency. This would be our recommendation going forward. You know, if you haven't already done this already at your dispatch type or your dispatch centers or in your RMS, we really need to start adding a unique type to track COVID-19. And I'll show you different ways we can do it with the existing data, but it's certainly, you know, going forward, if there's any way of possible adding a particular type to your dispatch type to identify this, we would certainly recommend that, whether that's in a new dispatch type or a new field or a metadata field, or even just in the comments. We really need ways of identifying COVID-19 related calls. So this is when you load this dashboard, this is going to have all the data in your incidents, or all incident data for your department. And what we need to do is to start isolating COVID-19 related calls. So to do that, like I said, we need to identify a way of classifying those calls. The easiest way that I recommend doing it is going to the Discover tab. And then, you know, this particular department, we get comments. So I'm gonna add comments. We also get type is probably a good way of so I'll add the type. Maybe there's another, you know, subtype or response class. It really depends department by department. What I really would recommend is to look up a particular incident number. So we can add incident number. For those departments that are starting from scratch, or, you know, after this meeting want to start trying to identify COVID-19 related calls, I would first start with a known call. So say, you know, this one right here, 9290777. Start with that, look up what the comments, what the dispatch type was for that particular call, and start trying to identify the type of calls type of keywords that you could search. So for this department, I can see already, I mean, just browsing, I can see COVID-19, COVID. Some departments might be putting it as coronavirus. I've seen other ones that do PPE advised. Really, like I said, it's not perfect, but it is a starting point to try to start identifying calls. So let me show you. So we could do things like description.comments is one of COVID, one of Corona, one of, let's see what we get there. So we can see, looking at some of these dispatch comments, issued COVID in building. So that's, PPE precautions. So that's a pretty good hit. Tested positive, showing signs. So these are all, COVID related calls, in my opinion. We can see there's a number there. If we look at the next column over, EMS call, advanced life support. So they don't have a descript type. Obviously, we can't just look at ALS calls because we need, we really want to just try to find COVID-19 related calls. The other one I might
as a
add
little
is
comment to that,
CPE.
what we have, Joe.
What was that?
Joe, as a little comment, we found that almost half of our COVID calls are not medical calls.
That's interesting. So they're not showing up as ALS. What are they showing up as?
No, they could be showing up as a fire alarm, and you get there and you find out the house is on quarantine.
Wow. So yeah, so that's, that's something obviously to keep in mind. COVID's not going to be in those type of calls, right? Or those type of dispatch comments. So they're going to be missed by some sort of dashboard like this, unless, again,
Well,
unless
they may be, because they may tell you they're quarantined or there's COVID, or so you may get that, but it's not necessarily an EMS call. Just to be aware of that.
Yeah, no, and that's first I had heard of that kind of situation. Again, just keep that in mind, and we do have a disclaimer that this is not perfect, right? we're only using the data that we have. So just keep that in mind before sharing this with any, sort of public or outside individual. Just keeping in mind that these are just related calls. Obviously, the word negative could be in some of these comments too, but these are COVID related calls.
Chop, I think one other thing you can do to validate that signature is look at the timeline. You can see the distribution of incidents starting about when you would anticipate to see COVID-related calls, right around 3/7/2020 and nothing before that. If you had a lot of incidents before when you feel like your community would first start seeing COVID incidents, you're likely including your search terms are too broad and you haven't quite narrowed down that signature yet.
So again, this is the first step, and I'll show you what Columbus has done too, adding a first-class element. It makes it far easier and far more, easy to do this. But for those departments that haven't done that yet, or really don't have the means of changing their dispatch types or adding metadata, this is our best suggestion currently, is just to search for keywords like that. So I'll go back to the dashboard. Again, so this first instruction, so we want to add that sort of filter to start looking at some of our calls. So I'll add it up here. So we can see we had 1,000. Now we're looking at 67. We have various, again, you can use any pre-built visualization. These are ones that we just have pre-built for this dashboard. So we have the total number of incidents, 67, at least, again, confirmed with what we're looking at is with incident where the comments had COVID, Corona, or PPE in it. As Tyler had mentioned out, you basically want to make sure that this time frame looks like it corresponds with the data that you would expect. So not really anything before probably January at the earliest. But you want to make sure that this looks right. So this is just an area graph showing the rise over time. One thing we can quickly see is, looking for the big spikes, right? So this particular 2-day stretch or 1-day stretch has a slope that's much higher than the rest of the chart. So that looked like an obviously bad day, but this should continue to grow as time goes on. Scrolling down, we have incidents by first due. So, station 1 has the most calls, station 2, stations 3, station 4. Here we have a heat map. Again, we use the gridded one here, but you could use any sort of heat map that you wanted. By default, this is looking at the last 45 days up top. I forgot to mention that. Of course, you could change that to last 2 weeks if you wanted, for example. So on the right here, we
By
have.
the way, that'll tell you one of the interesting things in data is I have mine set for 7 days, and I'm at 67 calls on 7 days. If I go up to 10 days, it jumps to over 100. So you're 60, but I have more criteria listed for
Right.
pulling calls.
Right.
But it was interesting to see when you said the 45 days that we're at the same number, 7 days versus 45 days. So it all depends on how you're sorting it.
Right. Yeah. The other thing to mention, we're not. We could add additional filters. So if we wanted to add the description.comments, if there's particular incident numbers that we just want to add because we know they're confirmed and there's no other way of identifying them, we could add them as filters up there as well. So again, you're going to have to curate this as much as possible given your department's data. We can certainly help, but you all probably know the data better than we do as outsiders, but please reach out if you're having a hard time at least getting that first pass at classifying the calls. So this one here is showing yesterday versus 3 days ago. So this is saying there's a 40% decrease yesterday than there was 3 days ago. This is kind of just an interesting one that I had saw on other public dashboards. So I thought would be interesting to show here. So that's generally a good thing. So less calls today yesterday than there was 3 days ago. We use yesterday just because today is not a full day. So it wouldn't really be fair to compare today versus 3 days ago. So that's why it's yesterday. This is showing the same thing as a line graph. So think of like the stock market, above zero is red. Well, the opposite, I guess. Above zero is bad, below zero is good. So right now we're lower, but it's still not consistently lower across the last week. Here we have average calls per day. So if we look at each day, so this is today, 325, we had 5 calls yesterday. Again, given the current filter, 6 the day before, 9 the day before. So you can see a day by day breakdown. We have the key metrics. So again, I'm guessing turnout times are obviously going to be going up, but it's something to keep an eye on. Obviously, everyone is keen on tracking these numbers. So we have the turnout time, the travel time, and the total event time, 90th percentile for all these calls in question. We have the incidents by units, so we can quickly see.
Couple quick things on that. One is, and we know there's a problem with our data on the turnout time, but the turnout time has significantly jumped because guys are putting on PPE that they don't normally put on. So
right.
That on these calls in particular, so that has increased it. And the one that was very interesting to us is that 125, which is close to my number as well. Obviously, you're pulling a little different numbers of calls, but our ambulance turnaround times from start to finish almost doubled from, say, 6 months ago. And it's because the time needed to decon the ambulances after the call.
Right.
So that number is significant for us. And it's determining that we need additional ambulances to cover the volume because we're literally losing an extra hour on average on every one of these.
Right. And your hospital is right in town, right? It's not like you're traveling long distance. Yeah. So yeah, again, those key metrics, if there's other ones that, transport would be a good one, we can get added here as well, or decon time, so you can track these. Incidents by units, so their ambulance 30A2, 30A1 is obviously getting hit the hardest, but their engines are also supporting these type of calls that we can see quickly here. Finally, at the bottom, you'll see a list of all the calls that are in view, right? So this is the entire list of calls. This proves as a great quick resource to, one, double check that the filters are, filtering what you expect. But they also give you a quick summary. So this is a COVID-related call, precautions recommended. You see the number of stations that were dispatched, the units that were dispatched, and then really most importantly for those, again, that we have the staffing information, we have employee IDs. This makes it, as a quick rundown, you can quickly pull and see what employees were on there. in case they need to log an exposure, take PPE precautions, go into quarantine. This just gives you a quick hit list of your calls that are in view. Does that make sense? And we can continue scrolling and we can see multiple pages of the calls that were in view. Before I show this on a couple other departments, is there any questions? Or Barry, would you like to share any other insights on, either how you're using this data or even, data side, how you all are reacting to the situation? If there's any, tips or anything you can share with the rest of the departments online today.
Well, the biggest thing, like I said, that ambulance time was useful because our administration's asking, do we need to bring more ambulances on board? And we did. We actually added an additional unit, which has definitely helped. It also became an issue of one of our neighboring cities is a very heavy user of mutual aid from us because they don't have sufficient resources, and we were able to use this to justify basically cutting them off. Go get your own was sort of the answer to that one because we're just too busy now to help you out. So those were sort of useful to pull those real quick. And we're more paying attention to the data from yep, it seems accurate. We're sort of, and we're relative, while we've had the NFORS for a while, we mostly were working the exposure side. We're relatively new on the data, dealing with the data side. So a lot of it's been more just checking to make sure things look correct and that we're understanding the program.
Right. So I'll show you what it looks like for another department. In this department, in particular, they have added, so Columbus, City of Columbus has added a distinct type. So I think it got added maybe 2 weeks ago, which makes it far easier to track, and I'll show you what that looks like. Again, to recap, so you can just create a new workspace, call it whatever you want. I'll remove these. So you'll see again the dashboard. If we remember from earlier, it's just going to be blank. $23,000, obviously that can't be correct. Remembering that we need to start filtering. So I could, what they've done, again, they've added a distinct type. So it's going to be showing up under description.type. So they added one called Contagious Emergency. So this makes it a lot easier, not only from the NFORS point of view, but for any sort of data tool or data tracking point of view. They can quickly pull those numbers. We can verify, so 627 calls is the metropolitan area, so obviously a lot more calls. We can see it only started earlier this month. So yeah, about 2 weeks ago, they've had 627 COVID confirmed call, or not COVID confirmed calls, but COVID related calls. The heat map, looking in the right here, we can see 7% again. So that's a good thing. It's going down, so it's colored green. But it certainly hasn't been the trend. They had a little bit of a downturn, then up, and then back down. Again, their key metrics, the incidents by units. And then again, so in this case, we didn't need to search the dispatch comments, again, because the dispatch center is dispatching this call as a distinct COVID related call. So this makes it far easier. You have far less, false positives. Obviously, we don't have anything before March, but it does, going forward, it's the best way in our opinion, and that's why we are recommending it for all organizations if they can add some sort of indicator for us to help identify these calls. They also have the staffing integration, so they can quickly see the personnel as well on these type of calls. I'll show one other one that I know has been working on it. Again, this is just as an exercise for you to start exploring your data, to start understanding how you might be classifying it.
Hey, Chop, just while you're waiting for that, since we get the personnel data, have you seen any departments actually aggregating the number of COVID calls by personnel so you can potentially identify which providers have the highest risks of some type of exposure just based on the total incidents they've gone to?
I have not seen any department do that, but I could certainly show an example of that if that would be useful. And if any department has done that online, please chime in. But I haven't seen it, but that would be a great exercise to just show the number of calls that each personnel has been on COVID related. So I'll show that as the next exercise. So this one, I can see, again, what I would recommend is looking up an incident number that was COVID related, and then, trying to identify keywords or anything that would allow you to classify that call. This one I keep seeing, PUI, patient under investigation. So that would probably be a pretty good keyword. I can try that and see what we got. So that looks pretty good to me. I mean, we can see the time frame. It jumped off. That's really a good, as Tyler had mentioned, a good judge of your classifier. So only starting in March, and then 163. Yeah. So this is pretty good. We can double check the comments: difficulty breathing, fever, elevated temperature. So this is just one way off the bat that I would guess would be a pretty good one. I would confirm with this department whether that's the way they're doing it. But again, so you could see that at their dispatch center, it's not a distinct type, but it is a distinct, I guess, keystroke, if you will. Everywhere it's the same. This makes it searchable, makes it easy for us to classify those related calls. So again, just to recap, we go into the dashboard. And then we add that same filter. So again, maybe it's the word COVID, maybe it's Corona, maybe it's PUI, maybe it's PPE. That's probably the most common ones I see is PPE advised or PPE recommended. And then we can see the data, and we can confirm the calls here on the bottom. Any questions before I dive into that last exercise, or any other comments, concerns, other best practices that departments might want to share? Now's your chance to share with the group.
Hey, Joe, David Medish here in Colorado.
Hey, David.
Couple quick questions. Is there any way in that visualization where you have the description and comments, that filter at the bottom where we're pulling out that data to increase the comment size column so we can read more right away without going to the drop down? I'm trying to make this chief friendly.
You're right. I think the only way would be to not use as many columns. Just have one of, just have the incident number and the comments.
Okay.
Yeah. Unless Tyler, do you know of any way to make that?
Not off the top of my head. I took a note to just look that up afterwards to see if there's any tricks we can find.
Yeah, I'll get back to you, David. But yeah, as far as I would just recommend not having the other columns for the time being.
No worries. No need to get back to me. I'll just educate some people.
Right on.
Second thing is,
educating chief, what a novel idea.
Sorry, no offense to anybody out there. They have so much other on their plate that they rely on people like me to give them the information. Second thing, just to throw out there, maybe add common addresses to this. We've noticed some frequent flyers where we're seeing that pandemic spread inside these facilities or neighborhoods.
Right. Yeah, that's a good point. Again, once you add this dashboard, you can modify it for your particular department. So David had mentioned, common addresses that should already be here. So we can go ahead and add that. This is just a starter dashboard. So again, you can start making modifications. So we can already see, as he had mentioned out, frequent flyers. So this address has had 3 calls already. That one has 3 as well. So, add that one. If you want to start tracking at the battalion level, maybe we add a filter for battalions. These are meant to be modifying for your department. So now we can start filtering. If we just want to see COVID related calls in battalion 7, we can click battalion 7. And we should see, so I guess they had all the same common addresses, but we see that number dropped from 100, I think it was 200 or so. So 79 that are just in battalion 7s. So again, these are just they're meant to be usable for everyone. So we didn't use in divisions or districts, but if those are important to your department, start adding the visualizations that are already there, whether it's battalion, council districts, divisions, districts, Senate commissioner. We have a lot of people that use elected officials too. So if that's important to you, add those visualizations to the same dashboard. You can delete this. Instructions, once you've seen it, it's probably not useful. And then we can save it. So again, this is just meant to be a starter with the most common ones that would be useful for tracking for your department.
Hey, Joe, this is JD.
Hey, JD.
I just wanted to put in there as well that once you switch your call type, if that's the choice that you want to do, just be aware that it's going to absorb a lot of your calls from difficulty breathing and ill person or similar type call types. So that's kind of what we saw was ill person's usually the highest on our EMS call type, and then difficulty breathing is either number 2 or 3. So just be aware that even though you put a new call type in there and it's jumping higher and maybe going to number 1 for that EMS call type, that it's absorbing a lot of your previous difficulty breathing or, for us, ill person call types. So you want to look at that disparity of when, the infection started in the virus to, previous, time frame. So we're only seeing maybe about a 1.8% spike, but our total incidents have gone down.
Right, that's a great thing to keep in mind. I'd be curious if any department is using an RMS system and tracking this either as a user flag or some other way of indicating an RMS where you actually have the ability to classify, say you were dispatched on a fire alarm and you went into your RMS and added a user defined field to classify that as a COVID call. That would be an interesting approach. I haven't heard of any department doing that, but I'd be curious if any department is doing anything like that where we could further refine the classification.
Hey, Joe, this is David again in Denver. If I can add to that, the NFA, or the National Fire Administration, through the NFORS module, came out with a bulletin to use a fire services casualty module to track suspected or confirmed exposures. So that's how we're doing it at a company level. Your product is awesome and catches all the CAD data from dispatch, but then we have that filter where we get those car accidents or that fire alarm where guys are exposed. Then we have a report that comes from there off of that fire service casualty module, and I could forward you that bulletin they sent out.
Yeah, that'd be a good thing. I didn't realize I'd issue that, so we'll get that added to the dashboard if that's the the NFPA recommended way. I think that's probably the way we should go.
The only problem, just to be aware of with that, is we're doing so many positive COVID patients now and we're starting to get a number of positive responders. We don't know which call was the contamination on. Or if it even was a call, could have been the firehouse for all we know.
Right. Yeah, there's only so, it's obviously never going to be perfect. And then you also
No, I'm just saying that's one of the things we're finding is there's no way to know, I mean, particularly all of our members who are positive had no issues with lack of PPE or PPE failure on the calls that were positive.
Oh, really?
So we can't identify where they could have gotten it from home for all we know. I mean, we just don't have any idea. It's the invisible whatever. So.
Right. So I'll try to do one more visualization unless there's any other. I'd rather have, if there's anyone else have anything to share in regards to either the data or the response and how your department is responding to the situation, please feel free to chime in. Otherwise, I'll bring up one more visualization that had come up as a suggestion. So this one was, the question was, tracking. So assuming we have your personnel employees coming across, tracking the number of calls each employee has been on. So we can do something like this. So we select the incident apparatus. We're just looking at the count of calls. We can split the x-axis. We have again, if you don't remember the fields, I just start typing. So let's see, personnel dispatched. Let's press play.
That's probably the count of people dispatched. Oh, no, never mind.
No, yeah. So yeah, this field has it's an array of all of the personnel that were dispatched. So let's just do this top 50. All right, so these are, this employee, I don't know if you know who that is, Barry, but he goes on a lot of calls, or maybe it's a stand-in code or something, or standby code. But we'll
I don't know. I can't see the numbers.
Oh, sorry, it's 80. Yeah. So yeah, we use numbers too because we don't want to show the names.
But these numbers correspond typically to either employee IDs or some departments use some type of radio number. But essentially, we're just looking at now the counts of incidents that employees have been on that meet this COVID-19 criteria in an effort to see who, if you make the assumption that going to more of these calls gives you a higher chance of exposure, we'll be able to see who has potentially had the highest potential for exposure based on just the total number of calls they've gone on.
Interesting. We have not looked at that from a data perspective in terms of we're tied to you guys with Easy Staff and we did it specifically for our exposure report to tie members on the rig to the incident. I've never looked at it from this side of it, from the data side, as to where, as to who's involved.
Yeah, it's a little bit more work with the employee IDs, but so you can then start looking, and probably even if you do have employees that come up that that either have to self-quarantine or that test positive, you could also theoretically go back and look at who all was on incidents with that person as well. So there's quite a bit that you could do here with it. We've added a unit to this visualization also and show you what unit they're on, at least then, or do the whole thing by units instead of by personnel too, which might be a little bit more, like I said, it might be quicker to kind of narrow that down. But yeah, you can start making some interesting just observations just by starting to open up the hood here a little bit.
Yeah.
Right. Again, this is, you could start filtering now. So if I want to just look at, now that I have that built, we can see, 7492. I can pull up all the calls they were actually on. Looks like they're on engine 24. I can tell that that's the common thread there. So they probably ride engine 24. We now have that filter on. So this is just the calls that 7492 has been on. Kona related, or not Kona, Corona related, sorry.
And how
so
did,
with that,
just real quick, how did you end up pulling that in?
So I created this this last visualization here called personnel dispatched.
Okay.
And yeah, you can give me a call after this meeting, Barry, and I can walk you through that too as well.
Okay, fair enough. Yeah, we'll have some fun with that one.
Yeah. So I'll save that. So with that, we do have 4 minutes left. I do want to add that we are, given the current situation, we are adding a few more, or accelerating a few more exposure features. So we are pushing out mobile notifications soon, as well as providing a way for admins to manually push a notification to employees to log an exposure. The idea being, now that we can actually classify calls of exposures or high risk calls, adding the ability for an admin to click a button related to an incident to actually notify the employees that were on that call to log their exposures. So there are 2 features we are diligently working on. Please stay tuned to our newsletter as well as our webinar notifications on when those are available to users. But we are hoping to get those out in the near term. With that being said, we do have 3 minutes. I'll stay on the line for any questions or comments, but if not, thank you all for joining. I hope this tool is useful. Like I said, we're doing everything we can to get the tools in place for you all to start tracking and to start handling the situation. If there's anything that comes to mind that we could do, please let us know. We're here to help. We're here to help you all out. So just let us know what you need. All right.
No one's jumping in. I'll start. Thank you very much. Very appreciated that we have that, and I will definitely want to call you afterwards to find out that one item.
Okay. Thanks, Barry.
Joe, this is Tony Murray.
Hey, Tony.
I wonder if I might be able to get some one-on-one time just to get started from the onset. I'm having a little bit of problem understanding where to go to set the filter.
Yeah, and you're from Hamilton County, right?
That's right.
Okay. Yes. So I'll reach out to you and we can schedule some time, either today or tomorrow.
Okay. Thank you.
All right.
Hey, Joe, this is Kieran.
Hey, Kieran.
Did you guys get Sacramento's issues with data sorted?
I'm drawing a blank because I'm not quite sure what the issue was.
Well, I
but-
done some training. I started some training with them, and then they were having issues in regards to their data. So I don't know if they reached out to talk to you guys about it, because they paused the training because they weren't liking what they were seeing from a data side. So,
Okay.
but Lori had mentioned that they might have some questions after this call. So I just wanted to know where the
Yeah.
situation was.
Okay, yeah, I'm not aware of the situation, but I could double check with our team here and see if it's been fixed or if they're even aware of what is going on.
Okay.
Hi, Joe. John Hardiman.
Hey,
I'll probably want to catch up with you at some point afterwards too. We've been, I personally been buried with new payroll system. We went to telestaff, so we were buried with that, and then rolled right into getting everyone ready to do, working from home, stuff like that. So I'll probably need a little help getting us up and running on this too.
who was this? John from Boston?
Hardiman, Boston. Yeah.
Oh, yeah. How's it going? Okay.
You have my
Sounds good.
contact information.
Yes, and Karan also is available for a lot of these training issues as well. But I will coordinate with Karan to see given the current influx of calls and support tickets that are coming in, what we're able to assist, and he's also able to help you out too.
Okay, great. Thank you.
Yep. All right. Well, I think if we don't have any other questions, we'll end it here. Sorry, I'm just looking at the comments. So Jeanette, okay, Jeanette, I will get with you as well so we can track in with Miami-Dade and Tony, David. Okay.
Hey, Chop, I think the other thing to call out, I'm not sure if you did, is just that we have a blog post also about some of this. So I'm sure you'll post the actual recording, but also if you all need help and kind of document some of the things that we tried to cover, the importance of identifying signatures for these calls and things like that. So that's another resource that's available for everybody.
And the best way to navigate there, if you don't already have a bookmark to our blog post, so right here in the instructions, you'll see the link to the blog post, the one in particular that Austin wrote up. So this really dives into the details of how you can identify those call signatures. So again, that's the first step here in the instructions. All right, well, I hope you all remain safe. Again, please let us know whatever we can do to help you all out, and we'll talk to you all soon. Thanks, everyone.
Thank you.
Thank you.
Thank you, Joe.
Thank you.